You're watching the news when you hear that one of your classmates killed herself. You start asking yourself, why would she do that? But nobody knew how sad and lonely she felt every day. To her, dying sounded better than living. As teens in high school, we all face some common problems: drama, social media, and the pressure of trying to figure out our future. If you are not careful with how you handle all these responsibilities, you could fall victim to teen depression. I have done a tremendous amount of research online, and I found out that depression can happen to anyone, anytime, and when it does, it will change your life dramatically. First, I will discuss what depression is and what causes it. Second, I will discuss the symptoms of depression. And finally, I will discuss the cures of depression. Depression is a lifelong disease if it is not treated properly, and there are several triggers to depression. According to a 2016 article titled Teen Depression from the National Institute of Mental Health, the leading federal agency for research on mental health disorders, depression is a real, treatable brain illness or health problem. If depression is left untreated, it is a more intense feeling of sadness, hopelessness, and anger or frustration. These feelings can last weeks, months, or even years. Depression can make someone feel like life isn't worth enjoying and like each day is a struggle. Depression can have someone feeling a bunch of different emotions, and here are some reasons why. According to a 2017 article titled Teen Depression by the Mayo Clinic staff, which is recognized for high-quality patient care more often than any other academic research medical center in the nation. It's not known what exactly causes depression, but here are some reasons why. Biological chemistry, inherited traits, early childhood trauma, and even negative thinking. The Mayo Clinic also states other factors that might increase the chance of developing depression. These include having issues that negatively impact your self-esteem, such as obesity, peer problems, bullying, physical or sexual abuse, and chronic illnesses like cancer, diabetes, or asthma, and the list goes on and on. A lot of problems can trigger depression, and the symptoms are endless. Often, kids with depression will experience a significant change in their thinking and behavior. According to a 2016 article called Adolescence Depression by Brian Cranes, a journalist and author, symptoms can include changes in appetite or weight, excessive sleep, suicidal thoughts or actions, or worsening school performance. According to the 2012 article Teen Depression and Suicide, Effective Prevention and Intervention Strategies by Keith King and Rebecca Vidora, two health promotion and educational professors, 28.5% of teens are depressed, and 15.8% of those teens had seriously considered committing suicide. Depression and suicide are intertwined among teens, with untreated depression being the leading cause of suicide. Suicide is a very common thought in teens with depression, and the only way to conquer this thought is to find the right cure for that individual. King and Vidor also said effective depression and suicide prevention programs should teach students safe and positive ways to cope with everyday stress, how to recognize depression and suicidal behaviors in oneself and in others, and how to get help and how to help troubled peers who are showing these symptoms. Early detection of depression is key in stopping depression among teens. Helping teens before they get depressed is the best way to conquer this, but even if you reach them after, there's still ways to help them. The Mayo Clinic states ways to help treat depression are with medication. The FDA has approved 2 medications for teen depression. However, if you are taking these antidepressants, you should always watch out for worsening depression, or unusual behavior. If case medication isn't the right path for you, then you should look into therapy. Another treatment is called psychotherapy. Psychotherapy is also called psychological counseling or talk therapy, is a general term for treating depression by talking about depression. Therapy is used in less critical cases, and if you have a severe case of depression, you might need to be hospitalized. In some teens, depression is so severe that a hospital stay is needed. needed. Finding a cure for depression is something that can vary from person to person, and it is up for you to find the right cure. First, I discussed what depression is and what causes it. Second, I discussed the symptoms of depression, and finally, I told you about the cures for depression. Depression can happen to anyone at any time, and when it does, it can be fatal. Her family was destroyed after she committed suicide and found out she had been depressed for years, and her friends beat themselves up for the rest of their lives. If you know anyone with these symptoms I mentioned above, it is crucial you tell someone before their depression overcomes them.